సాగునీటి రంగానికి అధిక ప్రాధాన్యత ఇచ్చి ప్రభుత్వం ముందుకు సాగుతోందని గవర్నర్ పేర్కొన్నారు. కొత్తగా శాసనసభ ఏర్పాటైన నేపథ్యంలో ఉభయ సభలను ఉద్దేశించి ప్రసంగించిన గవర్నర్ మిషన్ భగీరథ ద్వారా అన్ని గ్రామాలకు ఇంటింటికి నల్లా ద్వారా మంచినీరు ఇస్తున్నామని పేర్కొన్నారు. 2019 మార్చి నాటికి మిషన్ భగీరథ పథకం పూర్తవుతుందని వెల్లడించారు.
Government returned to power for a second term with a much higher majority in this House. The grandeur Mission Bhagiratha scheme, a first of its kind in the country, aims to supply piped drinking water to each and every household. It aims to supply safe drinking water to all the 66 municipalities and 23,968 rural habitations of the state. As of now, 56 municipalities and all the rural habitations are getting drinking water through Mission Bhagiratha. In 18,612 habitations, the drinking water is being supplied through Nala. In the remaining municipalities, the habitations, the works are on a fast track. I am happy to share with you all that by the end of March 2019, works pertaining to Mission Bhagiratha will be completed in toto. With a view to providing irrigation to 1 crore acres in the state, my government has taken up construction of major irrigation projects. All hurdles put up by vested interests by way of litigation or otherwise have been successfully overcome by the government. Forest and environmental clearances as well as statutory permissions from different central government sanctioning authorities have been obtained for all the proposed irrigation projects. I am happy to share with you that the recently clearances were given to the Sitarama project, which would convert the whole of erstwhile Khammam district into a totally fertile land. My government is making all-out efforts to obtain early clearances for Palamur Rangareddy lift irrigation scheme also. The Central Water Commission, which visited the site of Kaleshwaram project, which once commissioned will be a boon to Telangana, complemented the efforts of my government. Construction works on this project have been speeded up with a view to launch lifting activity through River Godavari during the coming monsoon itself. Recently, the Chief Minister personally visited the project area to see the ongoing works and later issued instructions to the concerned to complete the project as per the time schedule to enable supply of water to the fields. My government is committed to complete all the projects in the state within the next 5 years. As of now, 20,171 tanks have been revived in 4 phases, leading to increase in water storage capacity and the resultant increase of groundwater levels. My government spent rupees 77,777 crores on irrigation sector and in the future will undertake works to a tune of 1,17,000 crores.
విద్యుత్ కోతలను అధిగమించి ప్రభుత్వం తొలి విజయం సాధించిందని గవర్నర్ అన్నారు. కోతల నుంచి మొదలైన రాష్ట్ర ప్రస్థానం 24 గంటల నిరంతర విద్యుత్ సరఫరాకు చేరడం గొప్ప ఘనత అని చెప్పారు.
Of the Telangana state, the power sector was in dire straits. Farmers were forced to take recourse to suicides due to severe power cuts and electric shocks. Agriculture sector faced a large-scale devastation due to failure of transformers and motors getting burnt up. Power holidays and severe power cuts resulted in compulsory closure of many industries. In a very short time, has overcome the power crisis. Through sustained efforts and careful planning, this was overcome, and the state today is able to provide 24 hours uninterrupted power to all.
తెలంగాణ ప్రారంభించిన రైతు బంధు పథకం దేశానికి ఆదర్శంగా నిలిచిందని గవర్నర్ తన ప్రసంగంలో పేర్కొన్నారు. దేశంలోని చాలా రాష్ట్రాలు ఈ పథకం అమలు చేసే దిశగా సాగుతున్నాయని గుర్తు చేశారు. రైతులకు పెట్టుబడి సాయంగా రైతు బంధు పథకం ప్రవేశపెట్టడం సంతోషదాయకమన్న నరసింహన్ రైతు సమస్యలపై చర్చల కోసం రైతు వేదికలు నిర్మిస్తున్నామని వెల్లడించారు.
The Raitu Bandhu scheme introduced by my government aims to provide investment support to every farmer for agriculture with a view that he or she need not approach anyone for loans has earned all-round praise, including in the international arena. It is a matter of pride that United Nations FAO praised this scheme. Raitu Bandhu scheme has now become a role model to several states in the country. Several states are preparing themselves to adopt this scheme. Many agricultural experts and economists like Ashok Gulati have publicly stated that the Raitu Bandhu scheme is a unique one that alone can prevent a farmer from any distress. The Raitu Bandhu scheme has done away with the problem of agriculture investment faced by the farmer. Now it has become part of national agenda of the nation or action. On discussions in several platforms and in media coverage, we are frequently hearing the words Telangana model, much to the delight of every Telanganite. My government has introduced a novel life insurance scheme for farmers termed Raitu Bima to come to the rescue of the farmer's family in the event of his death, notwithstanding circumstances. Under this scheme, the farmer's family would get rupees 5 lakhs within 10 days of the death. As of now, rupees 283 crores have been paid to 5,675 farmer families towards Raitu Bima insurance. For strengthening the Department of Agriculture, for every 5,000 acres, one agriculture extension officer has been appointed. For providing a platform for farmers to discuss among themselves, Raitu Vedikas are being constructed.
ప్రజల సంక్షేమానికి అత్యధిక ప్రాధాన్యతనిస్తున్నామని గవర్నర్ వెల్లడించారు. ప్రభుత్వ ఆసుపత్రుల్లో ఔషధాల కోసం వచ్చే బడ్జెట్లో నిధులు మరిన్ని పెంచుతున్నామన్న ఆయన ప్రజల చెంతకే వైద్య సేవల కోసం బస్తీ దవాఖానాలు ఏర్పాటు చేస్తున్నట్లు గుర్తు చేశారు. ప్రసూతి శిశు మరణాలు తగ్గించేందుకు ప్రత్యేక చర్యలు చేపట్టామని వివరించారు.
Government has significantly developed the public health facilities in all government hospitals with a view to provide better Medicare to poor people. This has resulted in increased confidence of public in government hospitals. Necessary medical equipment, medicines, modern technology have been made available in government hospitals. For purchase of medicines in government hospitals, the budget has been enhanced threefold, and thereby required medicines are made available to people free of cost. Dialysis centers have been established in 40 government hospitals. In different hospitals, MRI, CT scan, digital radiology, 2D eco facilities have been made available. In district and area hospitals, the number of ICU units have been increased. The state has received several national awards in recognition of improved medical and health care. For the benefit of the poor patients in Hyderabad city and to bring medical facilities nearer to them, Basti Dawakhanas have been established at the rate of 1 per 10,000 population. Already 40 such Dawakhanas are providing medical services. In these Basti Dawakhanas, primary medical care and diagnostic tests are done free of cost. 4 new medical colleges have been sanctioned in the state to further expand the medical facilities and medical education. Admissions have commenced in Siddipet and Mahbubnagar colleges accordingly. In Suryapet and Nalgonda, admissions will commence from next academic year. Each of these colleges will have a 750-bedded hospital. Mortuary vans have been provided for transporting free of cost those who succumb in hospitals. This humane approach is a unique attempt undertaken by my government. For encouraging safe delivery, KCR Kits scheme has been introduced. Additionally, rupees 12,000 financial assistance is provided to women for institutional delivery. If the newborn baby happens to be a girl child, an additional rupees 1,000 is given as incentive. For use of mother and the newborn child, the KCR kit comprises of 16 items worth rupees 2,000. This reduces infant mortality, maternal mortality. Maternity and child care is done efficiently. As of now, lakhs of mothers have benefited by this scheme. For pregnant women under the Arogya Lakshmi scheme, a one-time full meal a day is provided to Anganwadi centers. Medicines like iron and folic acid are also distributed to them. Kanti Velugu program has been launched and being organized successfully to provide eye screening facility to each and everyone suffering from eye-related problems in the state. After free eye screening is done in every village and town, medicines and free spectacles are being provided to all those who require them. Surgical treatment is also provided when necessary. On the lines of the Kanti Velugu, large-scale health camps are proposed to be organized throughout the state which shall bring other diagnostic tests like ear, nose, throat, and dental for people suffering from these ailments. The health profile of every individual as well as that of the state will be developed following these diagnostic tests. For implementation of the scheme, necessary preliminary arrangements are underway.